We are live now.
Okay, hi, good evening, everybody. My name is Dr. Kiyana, and I'm probably the junior most person on the recording today. But we have a very, very esteemed panel with us, and we are very fortunate also to have the president of the Indian Orthopaedic Association, ATUL Sir, with us to give the president's address before we begin. Sir, can I hand over to you?
Thank you. Good evening, all. Namaskar. Friends, at the outset, I would like to congratulate WOICE and the Lady Cell of the IOA for actively participating.
I think we've lost his signal. Probably he'll get back. So for those of you who, till he comes back, maybe somebody can message him, CHASANAL or Saras.
Hello, sir.
Yes,
Sorry,
yes,
sir, we missed you.
So I was just saying that the contribution of the WOICE and Lady Cell is not only in their respective states, but across the country and even overseas, as we have been witnessing over the last few months. And not only in their individual capacity, but as a team. It is really heartening to note that. And I must mention here, Dr. RUJUTA MEHTA, your sincere and persistent efforts have started paying dividends now. Aarti and the team of the subcommittee of the IOA of the Ladies Cell are doing a satisfactory job. CHASANAL, Saraswati, RITWIKA, Samundeeswari. And today I just came to know IBREEZ represents Jammu and Kashmir. So it's a pleasure welcoming her to the IOA. I only wish if you could make some more members and add to the kitty of the IOA from the Ladies Cell. That would, I would say, strengthen you for the future. So each one, make one, and the job is done. We have a very interesting topic today with learned speakers, and I am eagerly waiting to listen to them. Thanks for inviting me once again. Over to you, KIYANA and CHASANAL, our moderators. Long live IOA, Jai Hind. Thank you.
Thank you, sir. Thank you so much for being here and for gracing us with your presence, because you have also helped empower WOICE as an entire body in itself. And that means a lot to all of us, because all of the recognition we're getting, the ability to do what we're doing right now also is because of your support. So thank you so much, sir. Ma'am, so we've got a very nice panel, because we've got a large panel that is spanning right across the nation. So 3 of us are from Bangalore, while 2 of us are from Bombay. We've got the first, as sir mentioned, the first member representing Jammu and Kashmir, which has been a very big deal for us. We've got Dr. Ritwika also from Kolkata, and we are very excited to show you that we have women from across the country here to show you that there is diversity. No matter where you go, you will always find somebody who is a woman in orthopedics right now as well. And Dr. Samundeeswari has also joined us, and she is based out of Pondicherry. So she is representing the East Coast, Southern East Coast. So without further ado, I would love it for RUJUTA ma'am, who is our founding chair of the WOICE, to just give a short extempo introduction about WOICE and why we are doing this.
Yeah, thanks, KIYANA. For all of you who haven't really heard about WOICE as an acronym, let me elaborate on that first. WOICE means Women Orthopedic Surgeons of IOA, Collective Empowerment. And it just serendipitously, this name came about. In 2005, that is the golden jubilee of the IOA, few of us women who had in the, now we call it a distant past, really taken this road less taken, because we never thought that it was something unusual to do. And we just followed our heart and did it. We were just trying to see how many of us are really there, because slowly and surely the numbers were growing. And it just happened that there were 50 names that we collected on the Golden Jubilee. So 50 and 50, that kind of, there was, if you all believe in signs and if you believe in messages from the universe, then that's where it was. And that's where we started for the first time thinking and saying that we need to come together. We need to, kind of create a platform. We need to share experiences, and we need to give support to the future generations, where if there are taboos to be broken, if there are difficulties which arise, and or if there are genuine problems which arise because we are working in a specialty where this gender is, it's not usual. I won't say shouldn't use the word bias. It's not usual for a woman to take orthopedics. So if there are genuine problems arising, then we need to find solutions. And that can best be done collectively together. It gives a lot of emotional support. It gives a lot of empowerment, and it kind of creates a level playing field for everyone. So that was the central thought behind it. And why not create a subset or a group which makes it easier for everybody to come out and showcase their talent, which makes it easier for people to shed their inhibitions, which makes it easier for women to relate to each other regarding whatever is that they are facing in their chosen field. And from time to time, everybody requires strength. I mean, that's it's a lesson in humility as well, when you think that, oh, you're this go-getter and you're going to do this what nobody else has done. Life teaches you in many ways that you will need help from time to time. There are a lot of men who are also great mentors. So collectively fostering this sisterhood was important to us. But maybe when the time was not right or something, we tried to form it in 2000, way back in 2005, and it didn't happen. And then out of fortitude, I think Dr. Atul Srivastava, who is now the IOA president, when he was the secretary, that's when I was taken into the IOA, I was rather elected into the IOA EC from Maharashtra as a Maharashtra representative. And we decided to at least give it a try. And lo and behold, it went through. By then, there were a lot many more names. And we said, now we need to have a very clear agenda and objectives as to what WOICE will do. By then, the international scene also was talking a lot about diversity, equity, inclusion, or DEI as it's popularly called. And we realized that IOA has a great opportunity to put all this together, because we were nearly 200 women, which is a huge group. And if you look at some of the countries internationally, there are 3 or 4 women in ortho, and they've formed a association or a group or a subset. So compared to that, we were already quite a large number. So the Indian voice also needed to be heard internationally. And that's how this started happening. We set aside a few things. Of course, there's always going to be a difference of opinion. There were people who said, why do you need, and there are people who still say, why do you need a separate platform? So my take on that always has been that it's not a separate platform. It is just something earmarked. Long ago, orthopedics was just a general specialty. From that, it has moved on to various subspecialties. So if you focus better, if you channelize yourself better, you can achieve better. And that was the whole purpose behind having that 1-hour session dedicated to PK Mullah Feroz. Because when we went into ortho, I mean, I really didn't know at that point that there was a lady who had existed in the 1940s, had truly braved the circumstances, the Indian scenario, war and the partition and everything, and still gone ahead and done something wonderful, pioneered and created a huge contribution in pediatric orthopedics. And that was late Madam PK Mullah Feroz. Unfortunately, she passed away a few days before the IOA, when we knew about 50 women in ortho. So we decided to commemorate this session in her name. And we also felt that since the girls are really competing neck to neck with the boys, so they need to have a diversity medal, not really a separate medal, but a medal in Madam Mullah Feroz's name. And slowly but surely, the representation is growing in every state. It is helping a lot of other women choose, or at least not hesitate when they want to take up this. And today, I think we are hoping to address these specific issues. I won't take too much of your time, but we have had now a great response abroad also. Waves, which is the APOA, incidentally formed their women subset only now, very recently, 2 years back. And at the present moment, I'm the chair and CHASANAL is representing India in that. In Waves, this year when a competition was held internationally in the entire Asia Pacific Orthopaedic Association, which is 60,000 members strong, guess who the first 3 prize winners were? All 3 were from India. And that was such a proud moment. And even when I was invited last year to New Zealand as the presidential guest speaker, because their theme was diversity, I think India's presence as a force to reckon with was very, very obvious. They internationally respect Indian orthopedics. They respect the education level and the ideas and the forthrightness and the confidence with which Indians take center stage now everywhere. So I'm very glad that IOA has really provided this platform to us, and we've been able to be of service to IOA. We intend to further, hopefully, contribute more in terms of articles, in terms of the committees. I think we really need to integrate better into every part of the fabric of IOA. And why not? If we do it in the community, we do it in our homes, why not in this? So, and I'm the bright faces that I've seen, the wonderful friends that I've made along this journey, I'm only glad and further enriched. So as we stand today with 390 girls on the Telegram group, and some seniors who are not really very savvy to be on a WhatsApp group and social media, who are at least 5 or 6 of them, I think they're slowly touching 400, and which is a great number for any international orthopedic society. Ruth Jackson Society is 1,000 members strong, but that in USA started at least 20-25 years back. So from 2016 to 2023, if they're already 400, well, I think IOA has a very bright future in terms of voice and carrying the voice and being heard internationally. So let Dr. Srivastava come.
Can I add a line to what RUJUTA has said, actually? Brought back memories to me. I am going to Malaysian Orthopaedic Association annual conference next week. When I was there last time, their president, their secretary, and their treasurer, all 3 were ladies. So I hope to see that one day in the IOA.
Oh, wow.
It's my sincere wish. And when I told them that we have a separate ladies cell in the IOA, they were mightily impressed. Just to add to that. Thank you.
Thank you so much. With your blessings, I'm sure it's like Aapki Zuban pe Saraswati aaj. So, KIYANA, let's further roll.
Yes, so I'm guessing by now a lot of the undergraduates would have logged in. So this is aimed purely at people who are aspiring, who have, this is a very large commitment. It's not something to be taken lightly. I just wanted to say that we aren't here to endorse and promote people joining orthopedics. That's not what this is about. This is about being able to help you make an informed decisions. We're here to just lay out the facts so that you can look at them objectively, listen to other people's experiences, the kind of prospects that you have in the future, because you can see it through all of these amazing people on this panel. And then you can take a call and say, whether this is for you or if it's not for you. And we'll also bust a few of the myths, which are the reasons you really shouldn't discount a field for. So that's the main thing I wanted to put out there first. And this is also not a male bashing webinar for all the people who are looking forward to something like that. You can leave the leave the webinar if that's what you're waiting for, but that's not what this is. This is about, showing you that what prospects exist, the difficulties that are there, and how you can take it in your stride, and how some of these women are doing it right now. So without further ado, let's start. So The first question is, what made you choose orthopedic surgery? So I want to put this across first to Dr. Rujuta, because ma'am is a senior pediatric orthopedic surgeon in Bombay, and she's got so many years of experience. And I just wanted her to give us her perspective of her thought process when she took the plunge all those years ago as a senior consultant now.
So what made me choose orthopedic surgery is a very, very simple answer. I liked it. I was getting it. And I saw no reason not to do it. So it's very simply summed up that these were the only reasons I went ahead and did it. And I did not kind of take to heart or take it too personally when I was told you should not, or you cannot, or you may not do it. All these three, the latter part, I kind of didn't take it personally. Yes, I gave it a thought. I did think of how I'm going to go about it. I, in fact, went to the extent of making sure that in internship, I spent a lot of my day hours and evening hours in the orthopedic wards and emergencies to actually see for myself whether I'm really up to those fracture reductions and things like that. So I spent extra time there to make sure, and the more I did it, the more fun it was. And what fascinated me actually about orthopedic surgery was pediatric orthopedics. If we look at the word Asthi Vyanga Upachar or orthopedics, the term itself is orthos and pedos. It was named because it is the science of deformity correction in children. So, it stems from there. It's not only about children, but that is what is reconstructive. That is what you really do. You make a genuine difference to somebody's life. And especially when you do it this young in children, I think you change not only the child's life, but even the family's life. So that is what not only gives you the thrill, it gives you a fulfillment, and the rest just followed. I think the universe conspires if you really, really, really want something hard.
That's great, ma'am. I also now want to put the same question across to IBREEZ, because IBREEZ has passed out from post-graduation not too long ago, just a couple of years ago. And she's a young surgeon working, and the only female orthopedic surgeon currently in Jammu and Kashmir. So I just wanted to bounce the same question off of her, because it's a different perspective. When times change, things change as well. So perspectives can change. So IBREEZ, would you like to give us your insight?
I took it way back in 1991, and now we're in 2020.
Good evening, and thank you so much for making me a part of this webinar. So I think the only thing I would agree with ma'am, first of all, the only thing that made me choose orthopedics was my passion for it. And this did not develop like overnight or at a later stage. I developed this in the beginning of my medical school. So we used to have these clinical rotations, and I was put into orthopedics in my third year. And we had a wonderful department. The PGs and our mentors and teachers, they made us actively participate in everything. It was not like I'm a female and they did not let me do things. So they saw that I wanted to learn things. I was inquisitive about this field. So it made them happy as well. So that drove my fascination into passion. And I think that is something that made me take this branch. I still remember when I joined orthopedics here as the first female orthopedic surgeon here. For the first 1 year, people used to ask me that, did you pick orthopedics by mistake? You had to click ophthalmology or OBG. So I mean, so these were because it was a difficult thing for them to understand, to comprehend as to why did she take this field. It was something very new to them. I think, but when you have this passion for a particular branch, for any particular branch, all these hurdles, I think you can overcome. There's nothing that keeps you back. You are going to face difficulties. There's no doubt about it in terms of working, in terms of people accepting you. But when you know that this is what you have to do, I think somehow you just, go through all these hurdles. I had a very, very good atmosphere in my hospital, even after being the first female PG in orthopedics. I had a very, very good support system in my hospital itself. From my mentors to all my colleagues, everybody was very helping. You have this thing that you have to prove yourself, because you have this feeling that there's somebody looking, over your shoulder all the time, and you have to prove yourself. So you overcome all those things. I feel you can overcome all those things because you need to have that passion for the branch. I think that's the only thing that keeps you going forward.
Okay, that was very, very beautifully put. So I'm just going to throw in a third perspective, because I've realized one thing, and I think that's because I just passed out hardly a year ago, and I've seen all of these interns come in and out of the department. And it's interesting because people don't realize that, even though you join a department and you leave, and these postings are hardly 3 to 4 weeks, and now because of NMC guidelines having changed, orthopedics in medical colleges has been abridged to just a 2-week posting, which is horrible. So So I don't know how people are supposed to make informed decisions that way. But what I want to also try to encourage some people to realize is that just because you liked a place for 3 weeks need not mean that you'll like it for the rest of your life. So never judge a subject based on the department, based on that particular college, or even based on the book as much as based on the patients, because all of these things change with time, but the patients are relatively consistent. And personally, for me, I loved ortho because the patients are awesome. The patients are great. The level of patient satisfaction that orthopedics has to offer is phenomenal. You can have someone come in on a stretcher and walk out of the hospital. So yeah.
We now have 3 more female orthopedic surgeons who have joined orthopedics after me here. So we have one in Jammu, and we have 2 more in the state of Jammu and Kashmir. So it's growing there as well. So I think we are breaking the taboo here. And everyone, whoever has joined because it was their passion. It was not because that's the choice they got or something like that. So everybody joined out of passion because it's such a unique blend. You have surgical skills, you have to have those problem solving skills, and then at the end you have this unique patient interaction, just as you mentioned.
Absolutely.
IBREEZ, I'll only add, I hope they're all on the Voice Telegram group, and I hope all are becoming IOA members.
Yes, ma'am. I will ensure that. Absolutely.
Okay, so I'm going to move on to the next one. So I'm putting this across to Pratima ma'am. Pratima ma'am is an orthopedic surgeon based in Bangalore. She's got a thriving private practice. She's an arthroscopy surgeon. She's also the mother of a lovely little boy who I think has just gone on his first day of school a couple of days ago. So she's a very hardworking lady, and she's got a lot to her name. She has not only graduated from Bangalore Medical College for her undergrad and postgrad, but she's also gone on to the UK. She's also done her FRCS there. She's gotten multiple fellowships, including the CCOT fellowships as well. So, ma'am, could you tell us briefly about your journey so far as an orthopedic surgeon, and from where you started and where you are today, because there are a lot of ups and downs that follow.
Thanks, Kiana. That's very kind of you. I'm great. I'm really delighted to be a part of this program. This is something I wish we had when we started PG about a decade ago. But I'm so glad that we're able to give back. So like you rightly said, I did do my undergraduation and post-graduation in Bangalore Medical College. And so it was, I think at that point of time, it was a toss-up of, a question that a lot of you might have to face of what do I do versus where do I do it. So I had a diploma orthopedic seat in Bangalore versus an MS seat, which I did have, in a couple of other places. Thankfully now, I think if I'm right, there are no more diploma seats or very few diploma seats. So I'm glad you would not have to make that decision. of choosing, whether I should do a diploma or not. But I definitely chose to stay back in Bangalore for personal reasons, because my aim was to get to UK. And my aim was to go there, do 2 years of MCH and come back to Bangalore. So I was making a smart decision then, let me have one degree from India, because if I come back and I join a teaching institute, they do not necessarily recognize your degrees from abroad. So I said, okay, I'll do my diploma orthopedics here. I had a wonderful, colorful 2 years of orthopedics in India. Every professor that I worked with, I had different experiences. We'll speak about that a little later, probably. So I did my PLAB exams back then. So this was back in 2014, where you did not have the medical training initiative. To those of you who don't know about it, I think this started probably in 2017 or 18 to go to the UK, where the respective hospital in UK would look after your, your medical council registration. So that was not there back in 2014. So I had to look after it myself. You had to do the PLAB examinations, the entrance exams, your IELTS. And my 2 years of MCH then landed up becoming 3 years, because I took up a prospective study, which was very unheard of in orthopedics. So I did a prospective study on synovial pH to determine whether it was septic or not. And, along the way, I feel there are, just like how Rujita ma'am said, there are forces working behind you which guide you and take you on the path. So a spot for a registrar opened up within 6 months of me working. And for that, you need to do your MRCS exam. So my consultant picked up on it and he said, you know what, do your MRCS. I'll give you off for a week. Go study, just go give it. There's an opening slot, do it. So I did my MRCS in 2015, became a registrar. And we were 4 registrars at that time in the hospital in Wigan. 2 were females. One was from Malaysia, myself from India. And the other 2, again, was an Indian and another person, the only person from UK. So he was actually, the minority in the 4 registrars that we had there. And it was equal. We were 50-50. So I think the main thing to take back from that experience that I had, as a first registrar in UK was, if you didn't think of yourself as a female, you never got treated as a female. You just do your work. Do your work, they're happy. Actually, they were more happy with us than the boys, because they would leave half the jobs and run away and we'd have to pick up after them. So as a treat, we used to get to go to theater a lot more than them as well. So yay for us. So, so that was the starting step. And then, my MCH got pushed out, like I said, to 2017, by which time I had worked with almost at least 10 to 12 consultants. And them having seen my practice. So you move every 6 months to a different team. So you have at least 2 consultants that you're working with. And having seen all the work that I had put in, though I had no aim of staying back in UK, they said, you know what, you've come so far. We'll sign you off for the FRCH exam. Why don't you try it in 2018? And that's quite unheard of. For, just 3 years, you need at least 5 to 6 years of experience in the UK. But they were quite adamant, they said, do it. And all my free time, I did extra clinics. I did spine clinics, pediatric clinics, because you needed all the information for giving the FRCS exam. All my consultants signed me off. And I was very lucky to get through the FRCS Part 1 in 2018. And I pushed out my wedding by a year, because I was quite adamant that I wanted to do my Part 2. So Feb 2019, I gave my Part 2. 2 weeks, I came here, jet lag, God knows what, dancing away. I got married in March and I've never looked back. So right now, I'm very happy that I have done what I had done. So it is a lot of hard work. So you pick and choose your battles. I chose to finish most of my hard work before coming back, because then I knew, because your priorities change. So my priorities then was get my degrees out of the way, get my training out of the way, so that I could then focus on my personal life, which I am doing right now. And I can do it comfortably without having any regrets. So while I was there also, I was a part of the member of Faculty Sports and Exercise Medicine. I did a SICOT fellowship in Prague for a month as well. So, what I'm trying to tell you is that there are people who will recognize that you're hardworking. So always put in the hard work, do good work. There will always be someone guiding you. You'll find your path. Be open to all opportunities that you have. Don't be stuck on just, I'm going to do this and only this, because, it works out beautifully in the end. So this was pretty much my journey. So right now I picked up most of my arthroscopy skills in UK. I'm doing arthroplasty here as well. Basic trauma. I'm not doing emergency thanks to my child, but no regrets again. I'm happy doing what I am doing. So it's been beautiful, and I've met a lot of wonderful people along the way, and I've had a good life.
Thank you so much, ma'am. So the thing is that having that exposure also goes a long way, getting to see what it's like to work in another country, to understand how objective you can be when you see that the numbers are even. So it changes your outlook on so many things. So thank you for that. I also want to bounce the same question off of Saraswati, ma'am.
Yeah, hi. So my journey is slightly different. I studied all through in India. I didn't get a chance to go abroad. I mean, because my family, all those things happened in between. So I think the point of this talk is mainly to say that each of you will have your own journey, and then how orthopedics is the main part of your journey. That is the branch that you love. That is what you learn. So I did my post-graduation in KMC Manipal, one of the best places to do orthopedics. I mean, it's quite known for orthopedics. And I was trained with one of the stalwarts in pediatric orthopedics. Dr. Benjamin was my prof who made me fall in love with pediatric orthopedics. That's what I do now. So I think teachers do make a lot of impact in what you learn and how you, see the subject. I would regret taking medicine doing post graduation, to tell you frankly. When I was doing PG, I was like, why did I take up medicine? That is why I feel that post graduation should be really tough, because it prepares you to do whatever, any difficult situation you're able to face now with so much ease, because those 3 years of hard work has, put you in a different pedestal. You can manage anything that comes to you. Even if it is in the middle of the night, you know what to do because you've been trained in such a way. So yes, I never regretted taking orthopedics, because if I want to do anything ever in my life, this is orthopedics, because I love the subject. As Kiyana said, the results or the satisfaction, the gratitude that you get at the end of the day looking at the patients just puts you in a different level. So that is something which I really enjoy in the subject. My journey has been from Manipal. I did my pediatric orthopedic fellowship in Chennai with a senior most professor. He is now 80 plus, close to 90. And the warm welcome I had with him, Dr. Sriram, and the conversations. He will never treat you differently because you're a girl. We were two fellows. You are treated equally. It is in India. It's not abroad. And again, very less number of girls were taking up orthopedics. That is about 10 years back. But then they see how much of hard work you're putting on an everyday basis, the way you manage trauma, the confidence they get looking at the way you work. That creates a lot of difference. And eventually I worked in a lot of medical colleges. I moved in places because my husband was in IT sector. So I got exposed to a lot of medical colleges, different set of people to work with. And believe it or not, those who had apprehensions initially that the girl is joining a department, within few weeks, within few months, the whole thing changes. There are still postgraduates who call up every day, once in a while, I mean, on a regular basis, to ask, what should we do this for this case, ma'am? That kind of interaction still continues, and you know that you're doing a good work. So yes, the journey has been beautiful. Yes. So to those who are going to take up orthopedics and then they regret, believe that all post-graduation, irrespective of the branch that you choose, is going to be difficult. It's not about just orthopedics. Orthopedics is slightly more difficult because you have emergencies, but
OBG is also difficult, ophthalmology, all the post-graduation subjects are going to be difficult. But if this is your passion, I think you should go for it. There are a lot of people who are going to support you. We have a very good group in Telegram. The moment you take a PG, you'll be a part of that. Any queries, any questions, you have a lot of people within your city, within your reach to meet. I think that will be very helpful to you. We did not have that, but then we're making sure that you guys are going to have it. So that's what I would say.
Yeah, like ma'am said, sincerity and hard work will always persevere no matter what the case is. Also, ma'am's absolutely right. There is no easy subject in post-graduation. I mean, this concept of I want an easy subject doesn't work. Subject, whether it's a paraclinical or clinical subject, doesn't matter. They all have their own sets of struggles. But if you're passionate about what you do, you'll be okay struggling. You wouldn't mind the struggle. So it's important to know what you're willing to struggle for. So on to the next one. Do you need to be physically strong to be an orthopedic surgeon? So I want to, because this entire thing has been played to be, an orthopedic surgeons have to be hefty and have this gym buff stereotype and stuff. So I wanted to bounce this off of Ritwika. She's based off of out of Kolkata right now. I just wanted to know, how much importance would you give physical strength in your practice in orthopedics?
Hi, hello. Thank you so much for this question. Actually, there is no doubt, right? Definitely, orthopedics is a physically demanding branch. Saying that, at the same time, after all these years, we also know the importance of technique and correct reduction maneuvers. Like when you follow the steps, they're there for a reason. There's books for a reason. When you follow that step, it is easier. It is not going to be a walk in the park, but it is going to be something gratifying at the end of the journey. Now, definitely, when we come to do the same thing over the course of our PG ship, we learn the tips and tricks. We know what works for us, how to apply traction, to have a femoral distractor handy, or to apply pre-operative traction in some cases, so that we anticipate what can go wrong and be prepared for it. And at the same time, it is not something that we need to be scared of. We need to be so physically strong, and without that, it is not going to be possible to come up with a good surgery or a good outcome at the end of the day. So
Absolutely.
that's what.
And same question for Saraswati ma'am, because I just wanted to know if it's ever had any bearing on your practice, being physically strong.
As we said, orthopedics is a teamwork. Techniques, everything is important, and always take the help of your colleagues. There's nothing wrong in it. I would say that, I mean, when I joined orthopedics, one of my co-PG was smaller and shorter than me. I was like, if he could do it, I can. I mean, though I was not stronger than him, but strength is something that you, over a period of time, you get. And also, there is nothing harm. If you feel that you need a little more traction, you ask one of your colleagues to do it. In your OT, there will be n number of people, right? So I think that you need to use everybody's help if required. And you need to have basic stamina and strength, which you will get over a period of time. So KIYANA, you are the right example. I think you are quite strong in terms of your physical, fitness, but you
I'm
don't
just
look
bringing
that
my biceps into the camera just to show everybody how tall they are. So if anyone's got anything bigger than that, I think you'll be fine.
So that is what. So orthopedics surgeons will come in all shapes and all sizes and all gender.
I'd just like to add that she's a very good athlete. Okay,
yes, absolutely.
So the stamina that is there in the background work, right? So you won't realize it. So, don't, like you say, don't judge a book by the cover, don't judge an orthopedic surgeon by the size and what you see in front of you.
Yeah, touch wood, thankfully, I've not struggled immensely yet with any reduction. Just knocked on the table. So, but yeah, it is, I think the way to apply force, it's not about how much force you apply, but like the technique that you're using and the way you do it, that actually goes a long way. And I feel like there needs to be more emphasis on that. There have also been so many instances where people have given traction to the point of causing nerve palsies in trying to accomplish showing off their strength. So I don't think that those maneuvers are very necessary. So that being said, it's about knowing how much is right, and I think that comes with ample amount of experience. So now I'm just going to go on to the next one. And here I wanted to talk about this because this is something that I think is affecting everybody at every level, whether you have just joined orthopedics, just finished orthopedics, whether you are trying to get a promotion. So the issue right now is that medicine has become quite the cartel. If I may say so, the issue is now that you've got the number of MBBS seats increasing exponentially. Then you've got these finite number of postgraduate seats, which have somehow now increased over the past couple of years, with all of these medical colleges constantly wanting to expand. So I can say that the medical college I did my master's at started out with 2 seats, went to 4 seats, and now is at 9. So the problem here now is that there are no vacancies for these people later on in a lot of colleges. And the way that people portray orthopedics is that you've got to at least get a little bit of your learning curve sorted out during your senior residency. Now, the problem is not being able to get vacancies is a huge apprehension that most people have sent questions about. So because of that, I want to talk about saturation in metro cities, and I wanted to bounce this off of CHASANAL ma'am, since she has got a thriving private practice across 7 different hospitals in Bombay, not 1, 7. So ma'am, could you talk to us about the struggles you faced trying to establish yourself? And do you have any advice for the aspirants looking forward to a private practice?
Yeah, so thank you, KIYANA. And yeah, the 7 sounds good, but it has taken me more than a decade to set up that practice. And it's not easy, be it a female or male, the problems faced are equal. When it comes to a metropolitan city or a tier 1 cities, yes, the problems are more different. But at least people are aware that there are some subspecialties and which are promoted already. So like when I started my practice, my path was already paved. We had Madam RUJUTA ma'am and Binoti ma'am were already there. So people were not surprised to look at me as a female ortho. They were already comfortable seeing females around in the orthopedic department. And even when it came to the subspecialty, we had like the entire amazing team here. So there was a whole in fact, 2 generations, if we consider the legendary Jory sir, and then the second generation of ma'am and other mentors of mine. So pediatric ortho was already established again in the city where I decided to practice. So I think from what I have learned in all these years and the advice I would give to upcoming aspirants who want to take up ortho, that when you visit us or when you are observing us, what you see is a hard work of 10 years or maybe even more. And it takes time. So when you start a practice, you will see a lot of non-operative patients. You don't have a huge OT list, what you see with an established consultant. So you have to take one step at a time. Like Rome was not built in a day. The same way, you have to just take one step at a time. Take it slow. Be patient. Just like our studies have had a long curve, similar way setting up practice also has a long curve. And in now the younger generation, I see many of them tend to give up very easily. They don't want to set up their own practice, or maybe they think of different options, or they want to have a side hustle, another career, different options, along with being an ortho, because they think that there's no fast money maybe, and not the satisfaction what they have been seeing at their seniors. And like I said, it takes time. So we have to, like if you want to expand your private practice or set up a private practice, you have to just take it slow, take one attachment at a time. You could be in 3 or 4 places, and maybe you may not continue with all of them, but you would like to work in some place which are conducive to you. Stick to those. If some place you don't feel that you are not respected well, you are not taken well in that place, feel free to happily walk out. end of the day, our self-respect and esteem matters more than anything else. We are not there to please the hospitals or institution. We have to see at what we are bringing to the hospital or what we are offering at the hospital. And rather than being more dependent on the hospital, it's important that we have our own independent practice. So setting up a clinic and then having institutional attachments helps in a very good manner, because that's what is expected out of most of the corporate practice. When we visit them, they would always ask that, how many patients would you bring to the hospital? So that's the first question which is always asked. And we should be at that position. When you want to enter a hospital or a corporate place, you have to be at that position to answer this and be at par with another 10 men who are standing there to get the same number of patients, and in the OT as well as in the outpatient department. So that is important. And that's how we have to start putting our initial stepping stones and make them strong from the base. So the foundation has to be strong. It has to be done slowly. And every step, slowly, gradually you go on, it becomes better. Of course, you need to be very organized. If you want the practice to be really good, you have to be organized in terms of having a very good calendars, softwares, take the use of all the possible technology we can, and have a good team to help. So team in the sense is, of course, the qualified team is different, but a team which helps you and supports you, like additional staff where they will help you with all your appointments and taking pictures or helping you with the clinic or preparing patients prior to surgery. All these things can be managed by people who are not actually orthopedic trained. And apart from this, it is also important that you set up a small team where, or be in a place where you have fellows where you can be mentors to them. Because as I have grown, I have had very wonderful set of mentors. They are still there and they are still there to guide. Madam, not only in voice, but she has always been a wonderful mentor for me, even when it comes to pediatric ortho. And so similar way, it was my responsibility also to do the same. And I feel very good that apart from all the male fellows who have been with me, there have been 5 female fellows so far. And it is really nice to see the number growing every time. And when I was with Madam, I was the first female fellow with Ma'am. And now I feel good that after all these years, we have so many females here, and it's growing great. And I think what is important is that, like I mentioned, even when we are in the hospital, of course, a female is slightly, no matter what, there is a slight bias. We may not speak it out, but it is there. But you don't have to be the angry surgeon around or the cranky female around, but you have to just subtly and in a very nice, small way, or in a way which will be often recognized, just voice out that, where is my cabin, or why is it not ready? Why the nameplate is not put up, why the pay scale is lower as compared to the males. Because this is all the bias which we see when we come in the practice. Forget the bias we talk about when we are residents, SR, or even in a junior position. But when you come into a private practice, these are the bias. You will always notice that the cabins, they will not be very serious about putting up the nameplate for a female or female surgeon, any surgeon, not only ortho. I have seen this with other female branches, medical branches also. They also complaining that the male counterparts, their rooms are ready, but our cabins are never ready. Why are our slots not ready? So I don't know. I mean, if we face this year, so maybe it would be some other places also, it could be there. So like I said, we are not rebellious. We don't be angry, but we be that sweet, nice surgeon around who can happily just voice out. And of course, voice is always there to support. So even with this small little voice, we can be good in our day-to-day practice as well. And I think in all this, the most important part is that we have to manage our finances very well. So I think that's an important thing. So as female surgeons, sometimes we take that as a secondary thing. And if you look at the other surgeons around, the male surgeons or thing, we have to really be at par with them. We don't undervalue ourselves, or we don't undersell ourselves as professionals. So that is important.
That's a very good point. I actually didn't think about how there are a lot of people who do take the back seat when it comes to knowing their worth. So that's a very important point. And I do feel that this may not happen much in medical colleges, because I think that the pay is usually quite uniform because it needs to be at an institutional level. But this is a huge problem in private practice. And I think it's something that people need to be very transparent about. And, it's, you need to know your worth when you enter private practice for sure. So wanting to ask Samundeshwari ma'am, who is currently working in a medical college in Pondicherry, and I wanted to ask, what has your experience been like so far, ma'am?
To unmute.
Ma'am, unmute your mic.
Thank you, Kiyana, the Voice team, for adding me to this panel. To put in a short note,
Hello. Okay, I think Samundeshwari's signal is a little patchy. In the meantime, I'll just ask Saraswati ma'am, do you feel that women have it harder than men when it comes to picking up a job?
a short note, even the medicine.
I think she's back.
Samundeshwari ma'am, I think your signal is a little patchy. Can you hear me?
Yeah, I'm able to hear you.
Okay, great. I can hear you clearly now. Please do go ahead.
Yeah. So what you need to really focus on is to build up your career path and your pay scale or your recognition of your skill sets. And you really need to be negotiable when you join the work. Let it be a medical college, or let it be a clinic, or let it be a corporate hospital or a smaller hospital, wherever you work. So you just need to do a small homework before you join, and and always you ensure you are having a good skill sets. So what you will be paid for, or you'll be recognized, is based on your skill set, and not just because you have or. So once you have this, once you can showcase that you will be able to do a good clinical job, the hospital environment will be able to pay extra for whatever skills you have. So it is not only in tier 1 cities, in tier 2 or tier 3 cities, it is the same scenario over here. So you really need to be perseverance, and you really need to structure it out what is suiting you, and have a structured plan ahead so that you can move accordingly. Because as a surgeon, you need
I think ma'am's signal is.
keep evolving yourselves. You need to upgrade your skills. So you it's for the demands of the people, treat patients place for ailments and illness.
Samundeshwari ma'am, I think your signal is still a little patchy, because we're getting bits and pieces of conversation, but not the whole thing. Could you just check your network? In the meantime, I'll just bounce the questions off of a few other people till it gets fixed. Is that all right?
Actually, I'm able to hear all of you.
I think
Is that okay?
Samundeshwari, when you speak, you can put off the video and just speak, so that will make it more clear.
Yeah, maybe that.
Yeah, I think that's a better idea.
Yeah. Ma'am, so more than that, we wanted to know, was it difficult getting a job in orthopedics in a medical college? Because a lot of people are worried about not being able to get into senior residency, because like we've said, that the learning curve is such that before branching off into a confident private practice, a lot of people do want that hands-on and that to develop their confidence. So did you have any struggle joining a medical college?
I don't think so. There is a struggle in joining a medical college. You should be really open to the vacancies available wherever you get, and you need to do a small homework. As I said, what are the flow of patients in that particular spectrum of hospitals or medical colleges, and what kind of specialities are really good. Ortho has developed into a lot of subspecialties. So if you feel that that particular institute is going to give you that good amount of exposure for choosing your subspecialty, then I think you should go for it, however long distance it may be. Like how we choose our post graduation, we have to be little choosy, and we have to be little cautious in choosing our roadmap. So you have to design accordingly and ask people around there. Now we have a lot of social media, we have a lot of groups where we join, and we get to know what kind of work is really happening around there. And then you get to join there, and you start building your basic skill sets which is needed for that subspecialty, and understand how that subspecialty works, and then you build a career on that specialty over a period of time before you become an individual full-fledged private consultant.
Okay, thank you, ma'am. Saraswati, ma'am, do you feel that it's harder for a woman than a man when it comes to getting into getting a job in orthopedics? Because this is a major concern of a lot of the girls sending in questions saying that they find that nobody will hire them after pursuing orthopedics.
I would still say there is a bias. Most of the people who have not seen a woman taking up orthopedics, I mean, about 10 years back, when I was applying for job, there were a lot of men who were also applying. And then I did feel one or two places did have bias. But then I think it is their loss, because the places which gave me job were happy to have me as a part of their faculty. So if there is a bias, I would not say it's just for the gender. It is also, if there are 5 people applying and somebody is known to somebody, that kind of thing is still there. Today there was a news article where they said there were 200 people applying for a 20 some 2 jobs or something. Very less number of jobs available, and more number of doctors are there. And the thing was, is it becoming MBBS becoming almost like a BTech where you have no jobs? So the jobs are going to be less, but then you have to keep applying. You just don't expect apply at one place and expect them to give you a job. You have 4, 5, 6 options, and then whichever gives you and whichever works for you, you need to go for it. Jobs are going to be less. The PGs are more. The seats for senior residencies are less. So wherever you get a job, go and prove yourself. Do a good job, and then you will have good recommendations. People who see you work will definitely recommend you to the next stop. That is how I got into most of my places. My postgraduate mentor, recommended me for my fellowship. From my fellowship mentor put in a word, and I got my job. So people do inquire. So when somebody is applying for a job, and they will inquire your background, how is this person, and if they give you that this person, irrespective of the gender, has put in lot of hard work, sincere. What they look for is sincerity. You should be sincere. You should do your work sincerely. Mistakes are going to happen. If you're a surgeon, you are going to say, see some complication. But if you're sincere enough, that is what matters. So be good whenever you get a job. You look for multiple places. Don't expect the job to be served in platter. That is one thing. But then make sure that whatever opportunities comes across you grab and do your best. And that is when you will be, stepping stones to your final destination. So that's how it works, I think.
And I just wanted to interject if all of you all are okay with it. See, I think Saraswati's really put the problem very clearly, that there are more number of people qualifying and lesser number of jobs which are available. So I only want to tell the youngsters that don't stare too long at a closed door. If you're going by a system and looking only for permanent jobs or professorships or stable sort of situations like a 9-to-5 job, then you're going to miss the bus. So you have to try and look for private apprenticeships. You have to try and look for charitable organizations. At least charitable hospitals in Bombay gladly take up. And in fact, at the beginning of a career, those are good things to do. You will get paid less, but you will get much more exposure and good experience. And also look for, traveling. So there are smaller towns or something where you can go like for 2 days. People with private nursing homes who are just doing general ortho, they would love to have a specialist. So if you're ready to put in that much effort, rather than expecting something to get served to you, things all work out in the end. And then phase it. Like you can tell yourself that these 3 years, I'll do this first. Once I've built up a name, then I'll move on to something else. So life is full of transitions, and at every stage, you just need to recognize what is needed rather than expecting a set number of things.
Absolutely. I know that the other issue which a lot of people don't realize is people think that this is something restricted to orthopedics, which is actually wrong.
Kiyana, I'll just, sorry, interrupt you. We must thank Dr. Atul Srivastava for staying and really listening to all our banter.
No, sorry for interrupting. I didn't want that. But the surgery is now ready. I had postponed it, so now I have to leave. And it was really, really nice and very well conducted, Kiyana, and very well participated.
Thank you.
Thank you, sir.
Thank you so much. Thank you so much. God bless all.
Thank you, sir.
Thank you, sir.
So the thing that people don't realize is this phenomenon of the job market being very poor at the moment is not something that's restricted to orthopedics. It is something that is happening across multiple specialties. I had a very good friend of mine. She is an ENT surgeon. She did her ENT from Nair and came to Bangalore. And she's finished her rhinoplasty fellowship. She's gone and she's finished her MRCS ENT. She's done the works and she struggled to get a job. I mean, now she has one, but my thing is that it's not restricted to a single specialty. This phenomenon of vacancy is not existing. So, and I think this is a main problem that we're actually facing more in tier 1 cities, because everybody wants to stay in a tier 1 city and not venture into the tier 2 cities. And that's when we come to our next question, which is what are the differences in orthopedic practice? Because now, practically speaking, if we've got, now when I passed last year, 218 people passed in Karnataka alone. So you can imagine, no one is going to roll out 218 vacancies. Forget in Bangalore, but even in the state, it's not possible. So let's talk about the differences in orthopedic practice between tier 1 and tier 2 cities so that people can get perspective of how things work in tier 2 cities. So I wanted to bring this up with IBREEZ first. So you're presently working in a tier 2 city in a government college. So do you find, how do you find your patient interactions? And is it different because you are a woman?
So Kiyana, we really need to understand that we have these unique set of challenges, right? So first of all, it being a government setup. Second, it's a tier 2 city. And then both now clubbed together. So we need to understand we've got a lot of problems to deal with. It has a lot of advantages. It has a lot of good things as well. No doubt about it. So what all we have to deal with is deficiency in infrastructure, there is deficiency in manpower, and there is an unmanageable patient load, right? So once we've overcome all that, then we come to the point when there are some patients who have these reservations and they have these preconceived notions about a female being a surgeon. But I think it all comes down to how good you are at communicating. It's genuine for them to have these notions because they haven't seen many female orthopedic surgeons. They haven't interacted with female orthopedic surgeons. It's not so common here. So as we grow, I think this thing that we face will improve as well. And I believe, just as Pratima ma'am and Saraswati ma'am said, you don't have to take yourself as a female orthopedic surgeon. You have to take yourself as a surgeon. You're an orthopedic surgeon and you have to work as an orthopedic surgeon. The moment you feel like that, I think it takes you 2 steps back. So I think building trust and really good communication skills, it's crucial regardless of gender at all. So I think this is one thing we need to work on. And I think we are really good at this. We are really good at explaining. We are really good at communicating with our patients. I think this empathetic part in us, it helps us in the long run. It really does. Although we do face these challenges, but once you've actually interacted with the patient feels, it confides in you. So I think you overcome it there and then. But yes, there is a bias. There is a notion in which people have their reservations regarding female surgeons in tier 2 cities. Yes. So how do you overcome it? Just improve your skills. Just keep working on your communication skills. And I think our dedication is something that will actually break these barriers. And when we build like something together as like a team, like we are, so when we do that, I think it helps us progress as a whole.
Yeah, absolutely. No, since having that compassion and empathy,
Absolutely.
it definitely will go long. Ritvika has now split her practice between working in Kolkata as well as in adjacent areas. So we can pretty much say that you've got a bit of a tier 1 city perspective as well as, going into a more suburban area. So would you, how have you felt? I mean, how have there been any differences in the ways that patients interact with you in either setting? And have you had any difficulties in that regard?
Right. So as ma'am has said, it is a conducive thing for me to right now split my practice in 2 places so that I get more exposure, right? But the most important thing I've seen everywhere is patients just want you to patiently hear, empathize with their situation and understand what they want. Now, the main difference in tier 1, tier 2, I feel is kind of we have to understand their financial power and the kind of facilities that is available to them and also affordable at that situation. So depending on the kind of patient and the kind of results they would want, because in tier 1, more often than not, they would have come with after showing a multiple variety of surgeons for a long time, and they would want further investigations immediately rather than further like starting on some medication. Whereas in tier 2, they would want to start some treatment and then see with time as it progresses to see further steps. But also what we see more in tier 2 cities are neglected cases or cases misled by local co-ops who kind of they take a little advantage of the situation also, and then it becomes a difficult situation to explain to the patient what has happened. But I think most importantly, it has always been to explain to the patient, no matter where he is or wherever we are practicing, what has happened and what can be done to give them a good idea of the prognosis and the options available so that they can choose what is best applicable for them.
Absolutely. And Samundeshwari ma'am is currently, because you're in a medical college, private medical college in a tier 2 city, have you had, how has your experience been in comparison to the experiences that IBREEZ and Ritvika have spoken about?
To be frank, in tier 2 cities, patient will be most of the, as she said, neglected patients. And yes, you do get patients directly walking into you because of word of mouth for your work and skill set, what you have done. I have been here for past 8 months now, post my fellowship. So in this 8 months, I have my own patients bringing up their own relatives or their own subset of people who has the same issue, who have been neglected for years. And then they have seen good results, which we give. At the end of the day, it is all about properly explaining the condition to the patient and telling what possible outcomes are possible. That comes with experience. You really need to be transparent in what is exactly the problem and what is the solution possibly the patient will be getting, so that the patients will understand. And the next challenge in tier 2 city is choosing the implants. As we are all surgeons, we need to choose the right implants for the patients, and the cost which is going to again that particular patient, and we need to be ensured all the necessary set of instruments are available in wherever we go and we operate. So the quality of services has to be on par, or it will be on your part to take care. Whether you work in a tier 2 corporate, that the system is already established. So things are a little easy, but when you come as an entrepreneur or as a first generation to set up the particular subspecialty. So these are the particular challenges you will face. So you just have to take it easy and just need to figure out how you can make things better, and availability of services can be given better for that particular environment.
So I think based on what all three of you have said, that there's definitely a need for orthopedic surgeons in tier 2 areas, and people would actually, benefit mutually. I mean, from patients as well as younger surgeons by working in these areas to be able to better their skills and grow a practice as well. So, CHASANAL ma'am, what do you feel about this? Is orthopedic surgery still an end specialty? Because this is a reason, unfortunately, a lot of people are excited about joining orthopedics, is because they think it's an end specialty. So, what's your take?
Yeah, so because, yeah, you are right, because earlier we used to be always called as glorified carpenters, or even the fancy, we had those, there was a very nice paper, not nice, but it was a funny paper which spoke about the orthopedic surgeons are strong twice as ox and twice and more wiser and double wiser. Because initially the thing was that people take up ortho who are not wise. So they wanted to write in this paper that just because nobody wants to study much, they take up ortho. But now the scenario has totally changed. It is just not a glorified carpentry at all. We all know that what instruments were used in the past, or the way the techniques were. Now things have changed drastically. I mean, it has been a total 360-degree turn if we talk about it. So it's no more an end branch or an end specialty. And now with even the subspecialties, we talk about things even much more our own special interest. Like even in pediatric ortho, ma'am has a particular, Rujita ma'am has a special interest in pediatric hand. I have a special interest in cerebral palsy. So even in that, in the super specialty, we are subspecializing. So it has gone much more deeper. There have been like people now just specialize and do 2 or 3 procedures, and they are like masters at it. Any celebrity or a sports person or anyone like a social figure, if they want to get operated, they would go to this specific surgeon because they know that this surgeon is doing only this procedure, thousands of them, and he knows everything in and out. So now the subspecialty is gone to that level. So I think no more it's an end branch. And many a times the young females who want to take up ortho, they ask me this. And I always tell them that it doesn't end here. After doing masters, you might need to take up more fellowships for at least 2 to 3 years, and then again see if that fellowship is actually working around in your city and can you build your practice on that. So that is important. Even while choosing the fellowship, that becomes an important point. If I would think that I'll take up pediatric sports in a tier 2 city where kids don't play high contact sports, or where scopy in adults is also not very popular, then it might be difficult to do pediatric sports particularly. It's tough. Or if I talk about taking up pediatric rheumatology or something like that. So it's going to be tough. So we have to think about our environment again. And yes, plan the PG, after that the SR-ship and fellowship and the subspecialty further. Think how you're going to develop more skill. It's like a long journey, I think, ahead still. So it's no more like that.
Yes, absolutely. Now there are everyone thinks that they don't want to write NEET again, because if you do general surgery or general medicine and you want to get into DM or MCH, that you have to write NEET again. So they think if I write ortho, I can get away with it. But now MCH programs after orthopedic are coming under NEET.
Yeah. So we have a 3-year pediatric ortho MCH now. So it's just not easy. So like imagine 3 years of post-graduation and then MCH and SR-ship and then getting more fellowships abroad. It's quite a lot, and beyond being an end subject.
That being said, there are also fellowships that are there, which, don't require entrance exams and stuff. So it's not that these are the only options. The FNB has gained a lot of popularity as well. So that's
But there are
fellowship.
very limited seats. See, spine FNB, just 2 seats. And then there is hand FNB. So there are very few seats. And it's like hundreds of people targeting for those 2 seats. So again, it's not at all easy.
Because again, these people are the ones who have not gotten the vacancies. So they're just dying to get into something. They're all going to be pining for these entrance exams. So we've made it very clear now that this is definitely no longer an end. Right. So what's the scope for doing a fellowship after completing post-graduation? So I wanted to start with Pratima ma'am, because she's already done fellowships in the UK as well as the CCOT fellowship. So could you just, for the sake of all of the people watching, just talk mainly about your experience in the UK? Ma'am, you'll have to unmute yourself.
Sorry. Yeah. So, we've just been discussing that, there are very few jobs here in India, and unfortunately, people, post UG or even just after PG as well think, okay, I'm going to go abroad and it's going to be a very rosy picture and, I'm going to get a job over there. So I think what you need to understand is that every country has its own advantages and disadvantages. Okay. So, I mean, UK as well, I mean, brilliant place. I had great training there, but you have to understand the system that, is put into place over there. So when you go to UK, even after post-graduation, you fall back to the level of being an intern, despite doing your 3 years of PG, because that's where you start as what they call a senior house officer. And sometimes it takes 6 months, sometimes it takes even 12 months, and you have to finish your MRCS to be able to get to a registrar level, which is equivalent of an SR-ship here. So, and it's between a senior PG and an SR-ship, I would say, a junior registrar, because sometimes you will have fellows. So the fellows per se are people who have completed their training, who have even finished their FRCS, and are about to become a consultant, who will do a fellowship in a very specific branch that they have got their consultant job in. So that is the true meaning of a fellowship in UK. So if you have a fellow above you, that person is going to do most of the operating under the consultant. So you have to understand, and it's not there in all the hospitals. So it's a lot of information about what you're getting into, what do you want to do. The other thing in UK is that it is specialty based, in the sense a consultant is only a shoulder surgeon or an upper limb surgeon or a hip and knee surgeon or a spine surgeon. You do not do everything per se. In my exposure in 5 years, I found only one consultant who does only shoulder and knee arthroscopic surgeries. Right, so that is unheard of. To be able to do both knees and shoulders is a very unheard of job. So if your aim is to, let me go and see what I like and let me try to find out, then that would not be the answer, because you will be doing a very specific job for 6 months. So say you're doing a shoulder job, you're going to do shoulder arthroscopy, shoulder arthroplasty, and basic trauma related to shoulder, as well as, your fractionic femurs and your wrist fractures that come in. So be wise about it, be knowing of what is really happening there in UK as well. So when I went back, when I went way back in 2014, there was no MTI. So there was no saturation in UK at that point of time. We were about 10 orthopedic senior house officers on the floor, which included, GPs, general physicians, others, general surgery, rotations who had orthopedic, who didn't want to do orthopedics ahead, and a few of us who were MCH candidates who are very keen on doing orthopedics. I mean, we've done our PG and we know we want to do it. So more often than not, when they were put to theater, they would be like, we don't want to do orthopedics. So swap, we're very happy to be on the wards, and we would be very happy to go up to theater. So that it's a little bit about being in the right place at the right time as well, because though I was not posted to a specific consultant. So my initial exposure was in Wigan and Wrightington Hospital. You know, Wrightington is the birthplace of hip replacements. And you have a minimum of 10 theaters working at the same time. You have a minimum of 10 to 15 outpatients running at the same time. All different specialties. You have 2 shoulders, 2 hands, 2 foot and ankle. And you have a specific work hour. You know, if you're working 4.5 days, you're going to work only 4.5 days. You have a half-day session for your admin. So you have that free time to move around. And I will tell you this, I have never faced a no from any consultant. I've turned up to every theater possible. I've turned up to every clinic possible in my first year there. And when I moved around post-PG, that's when I realized, you know what, I actually like arthroscopy. And then that's what I focused on in my next 4 years. So not everybody who goes to the UK, you know, it's not necessary that you will have that exposure. If you do have it, well and good, but at least be understanding of this is how the process is there. And what happens after you're in UK as well. Okay, your end is, you know, whether you get into a training or a non-training program, you can read about it. I'm just going to briefly touch about it. So you can either be a non-trainee and you have to find your jobs. You are responsible for your own visa. So it's not a very rosy picture, but it's not difficult either. What I'm trying to say is if it's difficult in India, it's difficult elsewhere as well. But you got to understand what you're getting into. I think that's the bottom line of anything. And are you going to be treated differently for being a female or not? I think, you know, that's moving further and further away. Yes, you probably have a little bit of racism. There might be a little bit of, you know, being a female, male. But if you let it brush aside and, you know, just focus on what you want to do, it's not going to hinder you. None of it has ever stopped me from being where I wanted to be at that point of time. I think that's what is really important. Get in touch with people who are there. So right now it's slightly more saturated than it was before. So the work situation might have changed and it constantly changes. So from UK, there's been a lot of drift of people going to Australia because your degrees are recognized there. You have to get through an entrance exam. You have a lot of people from UK going to Canada. Again, your training system is recognized in Canada. Go across over there for fellowships and come back. The US is a completely different picture in itself, you know, because the residency program there is completely different. Get in touch with people there at the ground level, speak to people, understand. And you have a lot of examinations, you know, you have the SICOT examination. I think Samundeshwari is probably the best person to speak about the SICOT side, you know. There are fellowships, there are SICOT exams. So you don't have only the FRCS, traditional FRCS, which I've given the Edinburgh. You have an FRCS International, which you can take from here as well. So, you know, it's all about knowing what is really out there. And how will you know? Only when you speak to other people, when you go out there, when you move out. So, you know, probably Samundeshwari can speak a little bit more about the SICOT diplomas and what else is there afterwards. So I think wherever you are, find what you really want to do in orthopedics. Like really work with people. You have to spend a good 6 months or a year to really understand, is this what you really want to do in orthopedics or not? It's not 3 weeks of observership or 1 month of fellowship that is going to answer that question. Really work in that field. And if you know you're going to do it, go all out, do fellowships here, do fellowships abroad, educate yourself on it and continue to educate yourself.
Yeah, so everyone needs to make very informed decisions is what ma'am was trying to imply. And with that, I do want to pass on to Samundeshwari ma'am about talking about the CCOT fellowships, because you've done fellowships in India as well as the CCOT fellowships. So could you talk about CCOT very, very briefly?
Actually, I have not done any CCOT fellowship. The fellowship which I have done is an unstructured fellowship in Oman. It is not part of the CCOT, but I am a member of the CCOT Orthopaedic Society. I am into the various subspecialty committees of shoulder and elbow, and I do understand how CCOT functions. So CCOT is an international orthopedic society. So it offers a variety of fellowships in varied subspecialties. So you like any other structured fellowship, fellowship, you need to get into the application process and you need to apply, and you have to clear the interview and like meet your supervisor and fix the dates and ensure your travel, visa, everything is sorted out, and then you get into that particular like fellowship or whatever you want. So meanwhile, when you finish your orthopedics, your 3 years of your residency in India, usually in India it's 3 years, but in abroad it is for 6 years. Their training is for 6 years and followed by a fellowship, and then they specialize and start working in that particular subspecialty. So since our residency is 3 years, we need to understand that in this 3 years what we are learning is our basics of about that particular specialty. Like for example, in orthopedics, we need to build the basics very strong. We need to understand the basics of biology, how the bone heals, how the tissue heals. The concepts has to be very clear. And then you get a minimal exposure because we have a lot of fellowship trained surgeons now working in tier 2 and tier 3 cities. So our generation is little lucky enough to see what is happening in that particular subspecialty. So once you start developing your interest, start your application process, be part of the national society. For example, I am interested in arthroscopy. I am member of the state as well as the National Arthroscopy Society as well as the International Arthroscopy Society. So once you are part of the society, you get to understand how the particular society works, what kind of work is happening at each level of that society. So it will inspire you to identify your niche in that subspecialty. It will help you to pave way to see mentors, attend the local conferences and CME meetings regularly, where you can have some access to nearby mentors. They can help you to grow in that particular specialty. So gradually you start applying for abroad fellowships. So once your application process is completed, you can it will be easy for you to upgrade your skills when you have done a basic fellowship inland, and where you have already understood how that particular subspecialty works and what are the deficits you are lacking in that particular specialty. For example, if I'm a shoulder surgeon, to begin with in arthroscopy, so I need to learn the triangulation skills. I need to master how the instruments are going to work, do a couple of diagnostic arthroscopy, get familiarized with the different landmarks, both arthroscopically and open surgically. So how will I evaluate the patients? How do I get diagnosis, get it correct? So all these things are over. Then I step into the next step, do the advanced fellowship, start doing small complex procedures, find your supervisors who are inland, who are doing very good job at this particular specialty. Try getting, even if you're not getting a structured fellowship in a high volume center, it is okay. You can always figure out and start doing with a smaller observership programs. You go observe how it is done, come back, do it along with your supervisor, and try to build the skill on it, because we also need to be financially independent as we grow. So we need to take care of our family and personal life, and you need to plan accordingly. You cannot say once till I become a full-fledged consultant, I cannot focus on other part of my personal belongings. So you need to be very choosy in what you do and stick to it, stick to timelines. And then at each stage you will be meeting mentors at different levels, so you understand things better and you eventually grow along with them. Yeah.
Okay. Thank you for that, Samundeswari ma'am. So I wanted to now go into a very important aspect that I think a lot of people should talk about, which is radiation exposure. So the thing with radiation exposure, we've seen quite a few women develop breast cancer. A lot of people have not thought about the importance of having specialized lead aprons, which are well fitted, and the need for them among women. So I wanted to just talk to two of our panelists, that's Dr. IBREEZ and Dr. Samundeswari. Both are presently expectant mothers. And so I wanted to just ask Dr. IBREEZ, what are the precautions you have taken in the orthopedic OT now that you are pregnant?
It's very important to understand that you need to prioritize your safety. whether pregnant or not, right? So it's being pregnant in a male-dominated field in which it's not so common. You need to confide in your team. You need to tell them. That's the first thing you need to do. You need to make disclosure about your pregnancy to your team. And you need to educate them because most of them have no idea about it. So what I did way before I got pregnant, we had a seminar on effects of radiation exposure. And I did that. So I kind of, made everybody aware that what is supposed to be done. So what you should do is, the first thing is disclosing about your pregnancy, confiding in your team, and to be away from radiation, at least in the first trimester. That's what I did. 3 to 8 weeks of pregnancy are one of the most crucial weeks. So that's when you should have minimum or no exposure at all. So what all you can do is do the surgeries which do not require a C-arm exposure. So that's the first thing you can do. It's all right. You kind of feel overwhelmed at times that you're missing out on something. But I think it's all right. We're going to get back to it. It's just a break from the C-arm part of it. We can do all other surgeries which do not require C-arm, right? Then it's important for us to wear lead aprons. So we have specialized maternity lead aprons as well, which have a greater thickness and they have a wrap around, and some of them can be customized as well. So we should find out where we can get these because they're not easily available because people don't use them much. So they are available. You can get these and you should use these. I think these are things that you need to do to keep yourself safe. The thing that it's always going to be on your mind that whether is the baby going to be fine? Am I going to be fine? It's normal. I think it's normal. And once we have a good support system, we have overcome all these troubles.
Absolutely. That's a very good insight, especially for the people who are concerned about this aspect. A lot of people are worried about losing touch with practice, thinking about pregnancy and wanting to have the best of both worlds, which I think everyone should be allowed to have. CHASANAL ma'am, you have also developed a custom fit lead apron by talking to the manufacturers. Could you tell us about the modifications made in your lead apron?
Yeah, so to continue with IBREEZ, I'll just add that apart from the radiation, as female orthos who are pregnant, you have to be careful with the cement also, the bone cement. So the fumes are teratogenic and the pregnant mother should totally avoid being in the OT when cement mixing is done. And this I realized in my fellowship in US. So we had the morning meeting where the female ortho just said that today I have a GCT and I need the cementing done and who is up to just volunteer. And all the guys were very happy, like, okay, I'll be around, I'll drop in the OT. And I think what she said that it's important to disclose and educate our fellow colleagues about it. And then always take their help. And apart from radiation, yes, you should be careful with the bone cement as well. And this should be the message for even the aspirants who want to take up ortho, because it's not just radiation, there are other things apart, and even the stress and other things which come along with it. So it has to be handled very nicely with all the team support. And coming to the specifications for the lead aprons, yeah, so companies like Uniray, Kiran, they customize the lead aprons. Like IBREEZ mentioned, they do it for the pregnant women also, and they do it for everyone. So if you want a particularly customized lead apron, they do it. It comes with slightly more cost, but then it is important that we are covered properly from neck to up to the knee. So ideally, the lead apron should be around the knee, just either above or even below. So even if it's above the knee, the skirt pattern is usually above the knee, and that is sufficient. A thyroid shield is a must. The lead apron, the thickness usually varies from 0.3 to 0.5. What we have largely in the medical college, the thick, heavy ones, which weigh like 10 kgs or so. We get much more better customized ones, which could weigh less than 2 to 3 kgs. And they are 0.3 mm. And they have additional materials and plastics in it, which are safe. They protect and they make it lightweight. So we can have the one with 0.3 mm. And ideally, women should go for an all-round jacket, not just the front protection. And we should have a small size done for us. What we have in the OTs are usually large size because they're ordered in bulks. So the routine, what is available in the OT, what we see, the blue color ones, the light blue or the cobalt blue ones, they cost somewhere between 5,000 or so. And when we get it customized, the price would go for a roundabout 2-piece customized with our own print, name, and the thin material. It could go anywhere between 30 to 40,000. But important is that we should store it properly, no folding it. And after 5 to 6 years, it should be sent back to see if there are any breaks in the lead, and they replace it with a lower cost. And apart from this, we should always wear a TLD badge. So many of the places we don't have, but some places they do provide one. Ideal guidelines are to wear two, one inside our lead jacket and one above the lead jacket. So what I practice, I just get one TLD badge from the hospital. So I put it inside the lead jacket in the shirt pocket. But ideally, one is at the trunk level inside the lead jacket and one is above. So the above one measures the radiation which we have been exposed through the exposed areas like the hand, face, legs. And the one inside also gives us another measurement of the radiation we have. So ideally, the inner one is fine. So I think this works best. And most important is we should limit our shoots, of course, with more minimal invasive surgeries and small incisions. And we have gone to higher shoots. Luckily, some setups have mini C-arms for hand surgeons, pediatric surgeons. They limit the amount of radiation. Other things which we could take care is, apart from limited shoots, try to have our surface anatomy more stronger, build it stronger so that we can avoid basic shoots and get the number of shoots down, and have a good technician who uses the laser guides. They limit the shoots. And then there are ways like standing away. If possible, we should stand away. That reduces the exposure by 50%. So double the distance, we reduce the exposure 4 times. So the distance, if you're standing near the patient, if you just double it twice, then the radiation exposure becomes 4 times less. So all these things, if we take it even every day, we are thoughtful and mindful about it, maybe in long run, we can avoid getting exposed to too much of radiation, which is not good for even as such thyroid, breast, even for blood malignancies. We expose ourselves to all of this health hazards. So I think we should just take care of ourselves. Like she said, prioritize ourselves.
Yeah, so now this was another big concern a lot of people had. Is it hard to have a work-life balance in orthopedics? So I wanted to bring this up with Saraswati ma'am because she's had ample experience working in medical colleges as well as private practice. So I wanted to know if you could shed light on the pros and cons that you've experienced in both when it comes to your work-life balance.
What I would say is for a work-life balance is difficult for a mother who's working. I mean, to tell you frankly, as far as I was a PG or anything else, I mean, got married, things did not change much. But after having a kid, 1 or 2 years are very important that you need to give to your kid. And then that's where your work takes a backseat. And you need to acknowledge that this is not putting you back. This is your priority at that point of time. And then when you start moving on. So your first priority is you, your kid, and then the rest of the things come. Fortunately, kids grow up and you have more time. So you will be able to give it to your career eventually. Initially, it is difficult, when you're starting off, and it's not just for orthopedic surgeons, it's for everybody, whatever PG you take, whatever field you are in, as long as you're a working mother, you will have to balance it out between your work and your life. And at some point, you will be more giving to your work. For example, Pratima very well mentioned that, I mean, beautifully, she said that she had to postpone her marriage by 1 year because at that point, the work was priority. Now life is a priority. So you are the right person to answer what is priority at that point of time. and you have your voice group. So when you are in doubt, you can always reach to one of us who would have gone through one of these situations. We'll be able to help you understand what it is, and you can take an informed decision. There will always be, you will be at crossroads most of the time. Should I do this? Should I do this? You know, and when you take one road, you will regret not taking the other. It's always there. Though you don't know what it leads to. I mean, where is that leading you? You don't know. But then it's a human tendency to regret. But what I would say is, when you're in a tough situation, there are mentors. You can definitely call them. You can find out what they did and what helped them. You will have to prioritize depending on what your situation is. Nobody can tell you that this is what you should do or this is what you should do. What feels right to you, you should do. As a postgraduate, there'll be sometimes during post-graduation, you have, you're married or you are going to have a kid. I mean, there are, when I was doing my PG, one of the ophthalm PG was pregnant at that point of time. She delivered. So she had to do 1 year later. So, you prioritize what you want at that point of time. There is nothing right or wrong this way. But whenever you're in doubt, you have people in voice group who will, happily help you out in understanding what it is, and then you can take an informed decision.
So as ma'am rightly said, Pratima ma'am also has ample experience in trying to balance work and life. So the next question was actually for you. After having a child, how did your practice change to achieve a work-life balance?
Right. I mean, I think Saraswati just very beautifully put it across, that is, you choose what you want to do at what point of time. So I think the most important thing to remember is that you have decided to do what you're doing. So say you're working 2 hours a day, whether you're working 10 hours a day, whether you've stopped working or not working, or you're doing minimal practice, you've given up emergency, you have made that choice. So only when you start judging yourself and feeling guilty, you're going to think everybody else is judging you. So I think the first step is stop judging yourself. It's your life. You've chosen to do it. So, I've had a surgeon, not an orthopedic, but, she's done transplant surgery, and she's left her twins behind here and been abroad for a year. Okay. And that's what she wanted to do at that point of time. She said, you know what, I want to do my training and I want to come back. So there is nobody who can judge you, you prioritize what you want to do. The kids are very well looked after over here at home. She's doing what she wants to do. So I think, that feeling of guilty, unfortunately, is always there with the females more than the males. And that needs to go away. And, I'll probably be one of the very few people who does not do clinic on a Saturday. So since I've come back here from UK in 2019, I think the one thing which I've realized is I want to give my time to family. And once you start practice on a Saturday and a Sunday, it's impossible to give it up. So I never started it in the first place. The maximum I'll do is operate on a Saturday morning, and that's it. 10 o'clock, max 11 o'clock, I'm home. And the rest 2 days is just me and family. I don't do emergencies because I don't want to be called in. Okay, so that's a choice that I have made. So am I going to miss out on 10 or 15 patients? Probably, yes. But eventually, if you're doing good work, your patients will find you. So I stop my working day by 6 p.m. I'm home. I want to be home. I want to be home for dinner. I want to be there with everyone because I operate at 4:30, 5 o'clock in the morning. I'm up and awake and finished an operation before anyone else at home is awake. So I want that evening time. So then you get questions, oh my God, 6 to 7, that's when everyone finishes their work. That's when your outpatient will be really crowded. But it's all right. So what I want to really put across is that just because you're an orthopedic surgeon doesn't mean you need to sweat it out for, the entire day. Yes, in your initial period when you're training, do your maximum work, do your training so that you're able to make these decisions a little later in life and you can choose how you want to work. So, I mean, I want this first 6-7 years, probably till my child is in first standard. And then, I mean, he's going to get independent as well. He's going to have a lot more activities. I'll have a lot more time on hand. And I'll pick up my practice done. So I'm not competing against a male colleague of mine who's doing 20 surgeries, in a week, and I'm probably doing 2 surgeries in a week. I'm fine with it. So I think that feeling of being guilty should go away. Judging yourself should definitely go away. Work-life balance, like Saraswati mentioned, it's there in any field, especially if you're being a mother. And if you don't want to marry, you want to be single, it's fine. I was happy being single. And then eventually got married after my younger sister. I was like, "Theek, looks like marriage is on the cards. Chalo, I'll get married." I didn't necessarily want to, I wasn't that person. I want to be a mother. I want to be a mother. But then you realize, what, I actually do want to be one. So, life will play out. Your priorities will change as you grow up. You mature, and you realize that this work-life balance is totally in your hands. It's how you take it. So, I just want to point out, just a few months ago, I went to Hyderabad for a conference. That was the first time I left my child behind. And I said, you know what, I'm going to go for a 2-day conference. So I've planned the entire thing. I've planned the meals, everything. If he doesn't eat this, give him this, etc., etc. Left them hale and hearty. The next evening, I have come back after 36 hours to my child having a cold, my fever, my husband is ill, he has a cold, my father-in-law has not slept, I don't have a father-in-law. So, the entire house was basically, it just came down and they were just waiting for me. It's like, please, isko lo, you just please take him and look after him. So it's fine. You're mentally prepared that it is going to happen. So you make that choice. I said, you know what, I really want to go for this conference. And the beauty of it was I was not called back at the end of day one to say, you know what, everyone is unwell over here, please come back. So having that support from your family, despite what branch you take, is very important. If you feel you're getting into a relationship which is not supportive, rethink it. Marriage and being a mother is not an end line. If it's there, it's beautiful. I really always wanted to have a family, and that's why I've taken a step back. But you choose what is important to you and don't let anybody judge you. And at the end of the day, you're going to put in a little bit more sacrifice than anyone else. Take all the hits, take all the firecrackers that burst in your face, and do it happily. Because you're eventually going to do it, either unhappily or happily. You may as well, laugh it off and do it. It just makes it a lot easier.
Absolutely. No, I have a
want
doctor
to add a line there, Kiyana, saying that work-life balance is just as difficult for single women, especially in metro cities, because you're the son, you're the daughter-in-law, at times you're the bai, and you're also the own financer. There's nobody to bounce it off to. And you have to prove yourself. So it's basically whichever way life pans out, it is always going to be difficult, and how much is enough is what you decide. Nobody else can decide that for you.
Yeah, absolutely. No, and I feel like when it comes to this question of child rearing, I firmly believe it should be a shared responsibility, because I've seen that in my own household, where my mom is an ENT surgeon and my father is not a medico. And when my mom was at the hospital, my father was with me, or he just made sure the factory was a kilometer from home. So if I needed anything, he was there. So it's a thing of shared responsibility is important. Just as Pratima ma'am said, you have to have family support. So when you have support, then things become less of a burden on on any single person. So CHASANAL ma'am, could you tell us about how you maintain work-life balance, knowing that you have a private practice spanning over so many places? It's not that being married and children is what requires a work-life balance.
We can classify it as work-family balance, and then maybe some work-hobby balance, and all together. So although I feel Pratima and Saraswati have emphasized more about the family and taking care of child, but I would actually give an advice to both of you, that you both have to take care of yourselves also. That is very important. See, because we are in a male-dominated field, we have a different biology as compared to the male surgeons. We will reach menopause and we'll lose muscle mass. We'll not be able to do the surgery same way the men do at 60. We will not do it. And very wonderful, one of a gynec surgeon who's very senior, she told me this one day, that I am a gynec surgeon. I know all the hormones. No matter you are in this fancy ortho branch, but forget this, that at one point you will become weaker than the guys, and you have to take care of yourself. So I think we all need to be very careful and mindful about our health and fitness. And no matter whatever small hobby, may not spend hours at gym, but even 10 Surya Namaskars or doing a small meditation can also help us in a long run. So I think that is very important. Being slightly spiritual or doing a meditation is always going to help and give that additional glow to your face, apart from having all the fun you have with your baby, of course. So please do take care of yourself, and everyone should cultivate a small hobby, something which keeps them creative, happy, makes them feel alive, or adds to their life, other than being an ortho or other than playing different roles like Rujuta ma'am mentioned. We have endless roles to play, like a multi-purpose worker, but let's add a small thing for ourselves. So that's it.
I definitely want to reflect, I thank you so much for bringing it up, because I actually forgot to mention that, but you've said it so beautifully. Please look after yourself first. So I play the flute. I've learned the Hindustani way. I swim. So I think it's just that, you have to find your peace in this entire chaos, and probably that was one of the reasons for me to stay back over the weekend as well.
And don't suffer burnout. See, working weekends is going to lead to burnout. Surgeons are more prone to burnout as compared to physicians, so we have to take care of all these things. That's it.
Thank you. So beautifully put. Thank you.
Absolutely. So this is an important thing that not a lot of people going into a residency think about. So a lot of people are happy when women head the women's wing of any association, since they don't want to do it. But since we're still, and that's because we're a minority still, right? So, but Dr. Rujuta and Dr. Chasanal have not only participated, but also won elections on an even playing field while competing with male colleagues for positions in certain associations. So, Rujuta ma'am, over the past 8 years, you have been a strong presence in the orthopedic community, not only at a regional, national, but also international level. So could you shed light on what it took for you to reach this position? Because a lot of people don't like it when you play on an even playing field.
A lot of people, you're very right. A lot of people don't like it. A lot of people don't like it even more when you're not just going to be a puppet in their hands. When you come into all those positions with a mind of your own. In fact, I was nicknamed Hunter Wali when I was the Bombay Orthopaedic Society secretary. So when I was chosen to come into BOS as an EC member, it was just like a completely alien territory for me. I won an election in absentia. It was only because I was there presenting at every possible opportunity. I was there working at grassroots level, whether they told me in BOS to even go and sweep the floor, I would say so. But I would literally work neck to neck with all the boys, whether it was just standing out and taking in registrations or minding the stalls or preparing for the entertainment. And I made sure that if I was doing the entertainment, I made sure that it was seen with respect. It was not to be considered as, oh, she's only good enough for a party at night. I can stand on stage and floor an audience of 1,000 people with singing, dancing, or drama, but I will make sure it's done with dignity. I will not do, it's not like an item number. So that, all that kind of helped in seniors perceiving me as someone who takes up whatever she does very seriously. And then when the BOS secretary elections happened, it was a very bitterly fought election. I was up against
I think
someone
who
no one
deserve an applaud for all of the elections.
Someone
I know how you have gone.
Nobody would have dared to stand against, and maybe that's where the surprise element helped. And then after that also, I definitely decided to really shake up the system in terms of what is not acceptable is just not acceptable. And life is very strange. Whenever you enter difficulties, whenever you face music, you will realize that the same thing over a period of time, if you persist, is going to become an advantage. It's literally like persistence overcomes resistance. You just look at nature, look at how wind, soil, water, how they erode things. And what beautiful formations like the Grand Canyon and all can come out of, slow erosion. So washing away myths, washing away people's fixed notions about a woman in a position of authority is going to take time. Yeah, you don't have to take it everybody like the way I did, like straight away grabbing the bull by its horns. So over these 8 years, I've learned my lessons as to how to say the same thing in a much more toned down manner. What battles to pick and what not to pick. But once you pick the battle, go for the jugular. Because unless you finish what you've started, it loses its meaning. So you have to, have to be committed to all of those things. And then the rest has just really flown after that. It's like if your purpose is right, the means will follow. And that's my line on my WhatsApp, this thing, mission and motto also in life also, that your purpose first has to be right. How it will work out, leave that to God, to nature, to your own ability. Trust in yourself and to your intuition. But then don't give up. Otherwise, it's just a waste. Whatever you did, whatever you decided to change, you decided to change something because it was worth changing or something was going wrong. So then you're only not, forget others. You're defeating yourself if you give up. So all that has to happen. And then at every level, even small biases, like if you're given, if there's a panel discussion or a talk or a symposium to be done, stick your neck out and do something different. Because the turtle makes progress only when it sticks its neck out. Even if you're given the worst topic in the panel discussion, don't feel bad. Even if you're given the worst sort of only literature review at the end of a whole symposium where all the guys have taken the good surgical, meat. Whatever talk you're given, as long as you do that perfectly and well, a simple literature review, if you structure it nicely, if you make it interesting, if you point out what was the landmark article and why was it the landmark article, people will stand up and start taking notice. Then slowly you will be given the meatier subjects to talk about. Debates, edutainment. CHASANAL has been, I think, part of everything. She's been like my daughter. I made her do everything, whatever I was doing. Even we did an edutainment segment in Posicon and then YROC, where we had to present medical legal scenarios. Medical legal is a very dry subject. So we decided to enact it with little skits. So that is what, keeps the fun element intact in everything. And at the same time, you must not forget the message. So take it as a challenge, even if you are given some difficult position. And yes, associations work in very different ways. You have to remember, in associations, the sensibilities of everybody matter. It's not right and wrong. It's not black and white. It is really the collective and the collective energy which matters. So where to seep in with your own thoughts? Don't be afraid to speak up. At the same time, you should know when to sit down quietly and listen. And remember, respect is something, the more you give, the more you will get. So, I mean, I've learned it the hard way, but this is what has shaped my journey. Then you get picked up. Then you'll get picked up for good stuff, because people will have their eye on you. There will always be number of silent people watching. And I mean, if just imagine the thrill that people thought you will not be able to do something, and you go ahead and do exactly that, and you do it well. That is what kind of changes the scenario. And then once the paradigm shift happens, then things just flow.
Yeah. So that's I guess diplomacy is a very important aspect to it that we'll all learn in good time. This is an important thing given the recent instances that happened in Kerala, and I wanted to touch upon this briefly. It doesn't matter what field anybody decides to take regarding this. So Rithwika had recently faced an instance of workplace violence. Could you share with us the nature of the incident and what you would have done differently? I think we're very short on time, so just tell us as briefly as possible what happened and how you could have adjusted what had happened.
Right, Kiyana. It's basically I was on emergency duty, and you know how there's a lot of heightened emotions whenever something's wrong, and if there's something wrong with a kid or an elderly patient, often it was a Sunday night, nobody knew what was happening, and there was a lot of people at home maybe. So around 30-40 people had come in, and then it became a situation where nobody was ready to understand what was happening, but everybody was agitated. So I think what I should have done is ask for more security from the beginning itself, so that we could have helped the patient earlier, because it took us some time to get to the patient and do the necessary steps for that. So that could have been earlier if we could have restricted the entry from an earlier stage. Other than that, I really do. It is just about diplomacy and trying to communicate better. But sometimes at the heat of the moment, you don't know what's right, what's wrong, and you just try to make the best of the situation. Right?
Yeah,
So,
try to.
Ritvika, I want to just add on to that yes, you're right. You should get security early on and make sure that you wire or phone or always have an emergency number or a helpline on your phone. Even the Nirbhaya helpline 103, you can just dial. Everybody in that place should come to your rescue at that point. That time, forget about even, if you're trying to explain or something. First, make sure that you and the patient are isolated. Unless that happens, you won't be able to treat right either. And I don't know, but maybe we could ask a medical legal expert about the right to refuse. Document everything. And if that can ever happen, then that will change the scenario, because violence is something which is a very, very concerning problem, which is growing. And all of us will need to remember it. That at times it may just be something you said or something they perceived in your body language. But unless you isolate, dealing with a mob is impossible. There is no logic over there at that point. So get as much help as possible. Have a helpline on you always.
And the only time I would say, given what happened in Kerala, don't isolate when a person is brought by the police, because that's something that.
I mean, isolate as in isolate from the crowd. You can have one or two people around you, but not just you and the patient. That was really tragic, what happened in Kerala.
And for the last, I'm going to just wrap up with the last question. I'm going to direct this to Pratima ma'am. As the child of an orthopedic surgeon, were your experiences as a trainee very different to that of your colleagues? Ma'am, unmute, please.
Sorry, we have a couple of minutes.
Is
it out? It's 9, right?
9, yeah.
Right.
Go for it, ma'am.
Okay, right. So definitely, Dad is a well-known orthopedic surgeon with 40 years of experience. So did it make my life easy? Yes. Did it make it difficult? Definitely. So as a PG, you get the brunt of both sides. So I had it. I was ragged to some extent, punished maybe excessively, unnecessarily by some people, but then I had the beauty of being taught by professors who learned from that. So, that was a very beautiful experience that I've had. So what I want to basically say to, any UG right now who has a parent who is a doctor and you want to take up the same field, it might not be even orthopedic. Don't be hindered and don't be inhibited and don't be scared just because you're choosing the same field as your parent, your mother or father has chosen. Okay, be smart about it. That is what I would say. So what Dad achieved at the age of 37, 38, I did it about 4 years earlier because I had a great mentor in him. So I did utilize, the experience that he had to make sure I don't lose my path. And I knew what I wanted to do. And did I choose orthopedics because of him? He'd be flattered if I say yes, but no, because it was my actual UG experience. See, I became a doctor because of him. There was no doubt about it. It was very plain and clear. I wanted to choose medicine. And I have 2 sisters as well. One's a ped oncologist. I'm an orthopedic. The younger one's a plastic surgeon. We're all daughters of an orthopedic surgeon, but only I chose orthopedics. So it was not Dad which made me choose it. It was my experience in the medical college and my exposure after that which made me choose it. Was it a decision for me to come back to India? 100%. because he has struggled in the 90s when there were no instrumentations. He brought AO here, you know, there's so many things that went into it, and he's done the struggle, and he has a setup here. There's a clinic. It would be very crazy for me to try to just prove a point and say, no, you know, I'm not going to come back and practice with him. So, you know, it's different takes for different people. So I wanted to know what I liked. That's the reason I got out of the country, worked with people who did not know him, understood what I liked, trained in what I wanted to do, and did something that he wasn't doing so much, so I could add value to that practice here. And when I have come back, I am the junior most in his team. I'm the first person in theater. I'm the last person to leave. Nothing changes ethically just because you're a daughter, and you should never ever take it for granted. And this is not for orthopedics. I want to tell it to, you know, anybody who's entering the same branch, never take it for granted. You have wonderful mentors. I had a wonderful mentor in my dad. And I mean, I'm sure I'm speaking for everyone that we would be lovely mentors for everybody else. If you do not have anybody at home who understands the path, reach out to us. You know, I will guarantee 1 out of 10 person will probably shun you away, but 9 out of 10 will give you beautiful advice. And out of that, something will fit into your life situation, and it will guide you to where you want to be. So be smart about it. Use your mentors. My mentor from UK came for my marriage with his entire family. So you don't need to have one mentor, you'll have multiple mentors, and they will love you for what you are. And I really hope that we can give it, you know, return back to all of you as well.
Great. So thanks everybody, and thank you all for participating, and thank you everybody for watching. We hope that we've helped you in some capacity at least to understand what everyone's experiences on this panel as orthopedic surgeons have been. And we know that NEET counseling is coming up. The voice handle is always open for DMs. You can let us know anytime if you have any doubts. We're quite active, and we're more than happy to lend advice at any point of time. Also want to mention that on the voice page, we'll be putting up a feedback link if you'd be kind enough to give us feedback, so we can actually work on these programs and make it better for all NEET aspirants in the coming years as well. So
just a small note, thank you. But if anyone wants to reach out to anyone specifically, how would they go about it? You know, that's probably a...
So we can guide. So based on, for example, recently somebody reached out as a minimally invasive spine surgeon wanting to talk to someone about radiation, but preferably another spine surgeon. So we have such a vast network. I mean, we have a smorgasbord of people to choose from. Don't think there's any dearth. So I'm sure that we can make it easier. We are also planning on putting any NEET aspirants, once the counseling begins, especially in touch with women who have done post-graduation in the colleges of their interest, so that they can get a more objective idea before taking the plunge, because it's a huge commitment and you got to love what you're doing for those 3 years. So with that being said, I think we can call it a night.
Yes, but we can thank OrthoTV for this lovely platform, and IOA and IOA TV. And please do remember that we are all IOA, okay? You know, years back, it was the men who made it. Now it's all of us who are going to make it. And we are in it together, the men and the women. So it's just people of IOA which will take this to greater heights. So don't let anything hold you back. And thank you once again, KIYANA, for moderating this so well, and all the panelists for really openly discussing each and every aspect of this fantastic branch that is orthopedics. Yeah.
Thank you. Thank you so much.
Thank you, ma'am.
Thank you.
Rahul, we can stop recording. Rishi, sorry.
Rohit.
Rohit. Oh, Aarti just joined. Aarti, when did you come?
Thank you, KIYANA. It was amazing.
Yeah. Thank you. KIYANA?
Are we still live?
Thank you, everyone.
I don't think.
No, I think it's stopped.
No, it's saying live, recording
it's saying
live.
Custom live stream service.
Yeah.
It's recording, but Aarti is the current chair of Voice after me, and Aarti, thanks for tuning in.
Is she there?
She's had a busy inspection day in the medical college, so those are the disadvantages of being
Medical
in
college.
medical college, then you can suddenly be summoned for something, whereas private practice, we are just footloose and fancy free. Of course, they are daily wage earners, so both sides of a coin. So maybe I think we could
We
wind
leave
up.
the meeting, ma'am. Yeah,
Yeah,
because
yeah.
it's still like.
Yeah.
Okay,
Thank you.
bye-bye, everyone.
Bye.
Right.